Deep within the lush, vibrant ecosystems of the tropics, a new danger is brewing. Hidden from the headlines and the hurried pronouncements of global health organizations, a virus is quietly spreading, its genetic code constantly shifting and adapting. For decades it has flown under the radar, causing sporadic outbreaks that have largely gone unnoticed by the wider world. But now, the alarm bells are starting to ring. A surge in cases, coupled with the virus's worrying potential to mutate and spread, has scientists deeply concerned. This silent threat, my friends, is the outbreak virus, and it has the potential to become the next global pandemic. This is not a drill. This is not a hypothetical scenario confined to the pages of a science fiction novel. The outbreak virus is real, and it is spreading at an alarming rate. We've seen this story before, haven't we? A virus emerges from the shadows, silently spreading and evolving before we even realize the threat it poses. We cannot afford to be caught off guard again. We must learn from the mistakes of the past and act decisively to prevent another global health crisis. The outbreak virus, named after the Outbreak River in Trinidad where it was first identified in 1955, is a type of arbovirus, meaning it is spread by insects, primarily mosquitoes and midges. It typically causes a flu-like illness known as outbreak fever, with symptoms including high fever, intense headaches, debilitating muscle and joint pain, chills, nausea, vomiting, and sometimes a rash. While most people recover within a week or two, some experience lingering fatigue and joint pain for months. In rare cases, the virus can lead to more serious complications, such as meningitis or encephalitis, which can be life-threatening. The virus has long been endemic to certain regions of South America, particularly in the Amazon rainforest, where it circulates among primates and is transmitted to humans through the bite of infected mosquitoes. However, the virus has remained largely understudied and underreported, partly due to its remote origins and the fact that its symptoms often mimic those of other common tropical diseases like dengue and Zika. This lack of awareness and surveillance has allowed the virus to spread largely unchecked, setting the stage for a potential pandemic. In recent months, the outbreak virus has taken a dramatic turn, evolving from a regional concern to a global threat. The number of reported cases has skyrocketed, overwhelming hospitals and stretching healthcare systems to their limits. The epicenter of the outbreak lies in the heart of South America, particularly in Brazil, Peru, and Colombia. The virus has also gained a foothold in the Caribbean, raising concerns of further international spread. The situation is particularly dire in remote communities located near the Amazon rainforest, where access to healthcare is limited. Reports from these regions paint a grim picture of overcrowded hospitals, dwindling medical supplies, and healthcare workers struggling to cope with the sheer number of patients. The true extent of the outbreak remains unknown, as many cases, especially in remote areas, likely go unreported. This lack of reliable data makes it challenging to assess the full scope of the crisis and implement effective control measures. Could this be the beginning of a new pandemic? Experts have been warning us for years, and now it seems their predictions are coming true. But what does this mean for us, and how can we prepare for what's to come? History has a way of repeating itself. From the Spanish flu to the more recent H1N1 outbreak, we have seen how quickly viruses can spread and the devastating impact they can have. What lessons can we learn from these past events to better handle the current situation? In the face of a viral threat, our best defense lies in science and public health measures. Vaccines, social distancing, and good hygiene practices are crucial. But it's also about staying informed and following the guidance of health professionals. Together, we can make a difference. Now is the time to act. We must come together as a global community to combat this threat. Each of us has a role to play, whether it's staying home when sick, getting vaccinated, or supporting frontline workers. Let's rise to the challenge and protect one another.